Good evening.
Hi.
Hi, how are you?
Welcome to Wellness Wednesday. I'm Anna,
And I'm John,
my hubby.
and we are the Oil
We
Lovers.
are the Oil Lovers. We try to be here every Wednesday night at 8:30 to share our love of the oils and some interesting information about the oils and healthy living, help to support you, educate you, share, encourage you, inspire you,
Answer questions.
make you ask questions. Hi, Margaret. Just give us a thumbs up. Hi, Mom. Hi, Barbara. We're just going to give people a few minutes to hop on here. Tonight is going to be a really great night. We're going to talk about, hi, Susan. We're going to talk about sick care versus health care. And that's really what we're doing here. So we're just going to give people a couple of more minutes. Hope you had a good week. Hope everyone is feeling well. Our little grand dog, Mia, is not feeling so well today. Hi, Chris. So we're asking for good thoughts and prayers for little Mia. She's got an ear infection, and so she's fighting that today. We're happy that you're here. We can be reached. We usually step in there.
I do.
You're a little quiet.
I'm a little quiet.
We can be reached at
The OilLovers at gmail.com.
yes, or on this page.
Or you can go to our website, theoillovers.com.
Yes, or you can message us, instant message us. Any of those things. Okay, so tonight, let's hop into it because I'm really
Great.
excited about this. Why are we here? Why do we come here every Wednesday to encourage you about the oils? A lot of times when we're on this, we do talk about ways that you can use the oils. We talk a lot about ways that oils can heal symptoms and promote your health.
Mm-hmm.
But really why we're here is because we are passionate about health care versus sick care. Health care versus sick care. Now, what is that? I've broken it down into some hopefully easy to understand categories. Sick care versus health care, okay? And that's what we're here for. We're here to encourage you to think about that, ask the questions, be passionate about your own health. We always say that you are the expert on your body, okay, and what's going on with you. So that's really why we're here. And oils are awesome for health care. They're not just about adding them or using them to alleviate some symptoms, okay? I did publish a study, and once in a while I'll do that. I will publish a study on this page, the Butterfly Essentials page, from PubMed. PubMed is a site where there are medical scientific studies done. Medical personnel use them for research, for information. You can go on. It's a free site. If you just Google PubMed, it'll come up. Mm-hmm. This week I published a study of a blend of essential oils for post-operative pain and nausea. Okay, so why do we care about essential oils versus what is normally given for post-op pain and nausea? Why do we care about it? Go ahead.
No side effects.
There you go. Because what we are normally given for post-op pain,
because that synthetic crap will kill you.
You cannot say that.
It will kill you.
Okay. The medications that are normally given do have side effects. They really do. So look up your side effects of your medication. The blend was with ginger, peppermint, lavender. They did that one, and then they did a study with just ginger. They are very clear in the study. If you like that kind of thing. There are some people that just are like, you know what, it works, I don't care how. And then there's the other people that are like, well, how does this work? Okay, the study will tell you how it works. I'm going to emphasize again, the studies that are on PubMed are done with 100% pure essential oils. Okay, that's not from Walmart, that's not from Ross, that's not even from Whole Foods. Over 95% of the oils in our country are not pure. They can say that on the label if they have a drop of pure essential oils due to the labeling. Okay, the oils that we deal with are 100%. They're triple tested. There's a test number stamped on the bottom of your bottle that you can look up. It's third party tested. So you can look up and look up your bottle of oil basically, which is awesome.
Yeah.
Okay, so, and do people care about that? Yes, the people in the healthcare profession absolutely care about that. They absolutely do. So go to PubMed if you are looking for those, or if you're wanting to discuss something with your medical provider. Okay, so to the subject of healthcare versus sick care. What is the goal in both? Okay, in sick care, it is to cure that disease, that illness, those symptoms that you're having. Okay, the goal of healthcare is to express your health, your optimum health. All right.
So it's proactive as a
very proactive, right? Expression of health reactive versus cure.
Treat the symptoms.
Or treat the symptoms, right? The strategy in sick care is you as the participant are usually pretty passive. And again, that's what we're here for. We're to encourage you to think about whether that's best for you, most effective for you. In healthcare, your participation is active. You are active. So you go to that PubMed, you pull up the study, you print it out, and you bring it with you. And you ask your healthcare provider if you can discuss that or that you have questions. I'm going to tell you right now, it's likely that they'll ask you to make a separate appointment. I would let the people know when you call, say, I have this question, I want to talk about that. Can I have extra time? Because unfortunately, the way our system is now, our sick care system is moving people through. It's production in a lot of places. Healthcare is not about production. Healthcare is about getting to know that person as well as you can. So that's another difference. In sick care, the practitioner is usually pretty dominant, generally speaking. In healthcare, we're looking for someone who's more of a guide, okay, that can use their education and experience to give you feedback, answer your questions, and guide you to what you feel is the best option for you.
So okay? it could be that you get diagnosed with something, say arthritis, in my case, arthritis.
Right.
And so we've decided to take a holistic approach to the arthritis. And the first thing I'm going to do is drop 60 pounds. And we started that a couple of weeks ago. I've dropped 17 pounds so far. Over the
it's
course
about
of
2 months.
Yeah, about 2 months. And this, so that's already, so there's a proactive step. We've been using a combination of the oils, and I've completely changed my diet, eliminated all processed sugar. I don't drink coffee. I don't drink alcohol. Anything that can exacerbate the arthritis. So there's a real proactive approach, and I think that's what you're referring to here.
That is.
You're going into the healthcare provider saying, look, this is what I'm doing. This is what I'm doing to fix what's wrong with my body. Whatever I was doing before got me here. So now I'm doing the opposite.
Right.
And we're trying to turn this ship.
And again, when you take that route, you're expressing your health. When we start down the road of medications with bad side effects, that's to us not an expression of health. There are many conditions, some of them chronic, diabetes being a huge one, that with the right diet and the right exercise,
turn it around.
Right. And we have record number of children being diagnosed, and you can look all this up, it's on there, the information's on there. Record numbers of children being diagnosed with what is now called type 2 diabetes, what used to be called adult onset diabetes, meaning that this did not happen to you until you were older. You had years of not really eating the best or taking the best care of yourself. You wore out your adrenals, you overloaded your body, and you've acquired this. They changed the name from adult onset because so many children, partly because so many children were being diagnosed and it wasn't applicable anymore. Right. But that is a example of a serious, significant chronic illness that can be. Now, the thing to remember is maybe your symptoms aren't alleviated immediately.
Right.
A lot of cases they're not.
Could be 3 months, could be 6 months,
right?
Could be a year. It took you a while to get there. But wherever you are, whether it's obesity, which is what I have, whether it's diabetes, whether it's arthritis symptoms, it can be turned around.
So that's another difference, actually. You brought us very nicely to the next difference in the delivery of the care. The delivery in sick care is for the episode. In health care, it's a process that you're going through. And it takes patience, it takes perseverance, and the payoff is awesome. And I'm going to tell you, my dad, at 75 approximately, had an unfortunate accident where he fell and broke his hip. If he had been in the normal category or health category that a lot of 75-year-olds are in, particularly with diabetes, his outcome would have been very, very different than it was. In fact, if he had the obesity that a lot of people have at that age, he may not have made it through at all. But he because he was very dedicated to his health and cared about it his whole life, when he had that fall, he was not overweight. Okay. Now, you may say, well, I'm doing okay, whatever. But the point is at that moment, there's nothing, what he did for the years prior to that was either there or it wasn't.
Right.
So that's a great example to me because he recovered quickly. His recovery, his hospital stay was shorter. He was able to ambulate. He did not have to go to rehab or anything after the hospital. He was able to do physical therapy in his home. And again, his outcome could have been very, very different if he was carrying 60 or 70 extra pounds that a lot of people are carrying around.
And he ended up partial hip replacement. And I hope it's okay to say that. I mean, that's kind of private information, but there it is.
People know that he's had it. So
and he is recovered, and that man is up and walking, and and he's he offered me his cane the other day.
Yes, he did.
Because I was struggling a bit with my arthritis. I'm like, no, it's okay, Dad. Thank you very much. I'll just grab onto this tree over here.
Which he rarely uses, by the way. But that's a good example of, expressing your health and always being in the best health that you can be, especially for an unexpected event like that. So the motive between sick care and health care is also very different. In sick care, it's, you're fearful, You're fearful that you don't know what to do. You're fearful of taking a stand with your health. You're fearful of going against what the medical profession says. Now, I'm going to tell you this as a person that worked in the medical profession, and maybe you know this and maybe you don't. A lot of our sick care is based on whether someone's going to sue. That's what it is, a lot of it.
And dictated by
the physician or the nurse practitioner or whatever may not think that you necessarily need that test, or you necessarily need a multitude of tests, but they're going to send you for every possible thing.
Yeah.
In case there's a problem.
Bases are covered.
So that's, we all have to take responsibility for that, not just the medical profession. They do the best they can. It's not black and white. Many people think it is, and it's not that. And that's why having a practitioner that knows you is really awesome, because it's really, really hard to treat someone in 15 minutes. It just is. That's a fact. So in healthcare, we're talking about spending time, being able to have your questions answered, communication, feeling comfortable, and empowerment. So empowerment is healthcare versus the fear and pain.
So it's more of a co-creation between you and the health provider, as opposed to you walk in, you get, analyzed, they prescribe something and send you on your merry way.
Right.
So again, what we're doing tonight.
And that leads into the timeline, which is in sick care, it's episodic. They treat you when you come in. Healthcare is your lifetime. Yeah. It's a journey that you go on. Mm-hmm. We're not all of a sudden, because we start eating kale salad, everything is wonderful and the body's put back to reset.
No, my body rejects kale very quickly.
I like kale salad. But it's not about that. It's about a commitment to yourself over the course of your lifetime and taking one step going in that direction towards expressing your health.
And I want to thank you for inspiring me to do that.
You're welcome.
Because, I mean, my tendency would have been, when I started getting this leg pain, mm-hmm. my tendency was to run straight to the ER. And, Anna said, look, let's take a look at your diet. Let's take a look at what you've been eating. Let's take a look at what you've been consuming, what you've been taking, what supplements, whatever it is, and just let's get everything cleaned out. So we did a detox, and but things are really turning around. I'm extremely encouraged.
So that's the other thing. I mean, medication is given out very, very liberally. And again, we're not saying that there's not a place for medication, but you want to know what the options are.
Yeah.
And this goes back, I mean, a lot of you know this story, some of you don't maybe, but when I had a child that was born with a birth anomaly and she had a lot of surgeries, at one point she got an abscess and the surgeon said, well, we have to take that abscess out. And it was in a painful place, and that surgery is, it's not a nice surgery, and the recovery is not nice. You have to pack the wound and heal the wound from the inside out, and you have to pull that packing out and repack it. And it was really a lot to go through, and we did it. And she was a baby, a toddler, and then she got a second abscess a few months later in the same exact spot. And the surgeon's like, well, we have to do a surgery. Okay. So I geared up, we did it again. And then it was a couple months of healing. Well, do you know she got it a third time? And the surgeon says, well, we have to do a surgery. And my mom brain's like, no, what? We did 2 surgeries. And he said, we're going to have to put a colostomy in. Now, she had already had her colostomy reversed. And he's like, well, we're going to have to go back to put a colostomy in because something's going wrong down there. And we can't let food pass because we're afraid she's going to get a third abscess. I was afraid she was going to get a third abscess. And here's the thing, to make a very long story short as possible, I put my daughter on a fast. that was not offered to me. No one ever talked about it. And when I talked to other people about, well, what do you think about putting a toddler on a fast? They were like, that's crazy. You can't not feed your toddler. Well, that's what I did. I put her on a vegetable broth and juice fast, and I did heal my toddler. But all the time I was afraid. I was definitely afraid that, someone was going to report me, someone was going to, intervene, someone was going to do something. So I kept it on the down low, and no one, should be doing a colostomy when you can heal something with a fast, number one. I mean,
oh yeah.
that's
big
and
difference.
B, no one should be afraid to take their health care. And that's what these oils are about. They're about daily, your every oil has an emotional component to it. That's very important to your health. So when you're using these oils, you're not only using, that breathe stick is not only to promote good respiration, but it's also helping to release emotion, trapped emotions. So every single oil that you use has an emotional well-being component to it. So that's what this is. And using the oils is also setting yourself up for you loving yourself and caring about your health. That's what they are. And then it's awesome because you don't have nasty side effects and you don't have to take another medication to
take care of the side effect from the first thing.
So that's what we're here for. That's what we wanted to talk about. Sick care versus health care. We want you to think about that and see what if that resonates with you. Join us every Wednesday. If that resonates with you, send us a question. Start reading. Start using the oils.
We would ask you very kindly, if you would, to share this video as well. That's very important for us to be able to build the number of people who are exposed to this message every week.
And there are people who need to hear it. There are people like me who needed an alternative to what the system was saying to do. And it was just like, no. So tonight we're going to end with this. Our daughter-in-law Amanda's birthday is coming up here in a couple days, and she is passionate about health. She's also passionate about the world, Mother Earth, and taking care of the world. For her birthday, we are going to go the whole day plastic free. So we're asking everybody that's watching this video to maybe do some research about plastics in the ocean, plastics on the earth, how plastics decompose. And if you just take one step in honor of her birthday, for that day, don't use plastic straws or whatever it is. Just pick your step or go all the way like we are. That's awesome. That's what we're asking for part of her birthday present. So it does mean the world to her. We've mentioned her before. She does Norwex. So if you're interested in cleaning without toxic chemicals, she's your lady. And we wish you a happy birthday, Amanda.
So
Beth Baker's birthday's today.
Well,
she's probably not on, but happy birthday.
Happy birthday,
Beth. And we are happy that you joined us.
We really are thrilled. You can reach us on this page with a message. Anna's number is on here. And also you can email us, the OilLovers@gmail.com, or just go to the OilLovers.com. And you can link there to the page where you can shop and peruse oils and look at all the different things.
And if you are not working with a doTERRA person and there's oils that you want to try, just let us know.
We are the best doTERRA advocates on the planet. I'm telling you, sign up with this lady, you're going to get a gift basket. You're going to get hand holding. You're going to get
you're going to get a person who's really passionate about your health.
Indeed.
With you.
So we love you.
Yeah, we do. You have a great week, and we will see you next week.
It's all about those oils.